Hello, my name is Kevin Fernando. I'm a GP partner at North Berwick Health Centre in Edinburgh, Scotland. And this is my colleague, Patrick Holmes. Patrick, do you want to introduce yourself?
Yeah, I'm a GP also based in Darlington in the north of England.
Yeah. And we are both members of Goggle Dogs, a group of doctors passionate about all things CVRM. So please do follow us on Twitter at Goggle Dogs, not Google Docs, to hear all our hot topics and discussion about a range of CVRM topics. But today, we've been tasked with discussing a specific area of potential confusion for all of us when trying to improve the care of our patients living with diabetes and coexisting CKD. So what do we think about the use of SGLT2 inhibitors versus metformin as the initial treatment for diabetes in CKD treatment? Now, this is very topical, isn't it, Patrick? Because you led on a tutorial for us on our Goggle Docs platform, Twitter thread, looking at this very issue as part of the draft KDIGO ADA joint consensus report on diabetes and CKD management. So do you want to tell us a little bit more about KDIGO and ADA's take on what we should do?
Yes, you're absolutely right. This was the KDIGO and ADA working together. So I suppose that the right people to be looking at the issue about the management of type 2 diabetes and CKD. So, and what did they say? They said not one, not the other, both. And I would wholeheartedly agree with that. I suppose if I was going to expand why, we've got to think beyond kidney outcomes. Obviously, cardiovascular outcomes are really important when we're dealing with such a vulnerable group. And we, building on metformin from UK PDS, and obviously SGLT2 inhibitors with the plethora of data which has come out over the past 7 years. So for me, it would be definitely wherever possible, assuming they've got appropriate EGFR, that you would be starting both dual therapy from the get-go. And I would perhaps even throw in, maybe you should be thinking about their blood pressure and statins.
Good stuff. Thanks, Patrick. And actually very timely for all of us working in the UK as well. We had recently updated NICE guidelines, the National Institute for Health and Care Excellence, on the management of type 2 diabetes. And again, this guideline gives us a clear steer, didn't it, Patrick, for people with type 2 diabetes and high-risk cardiovascular risk conditions such as chronic kidney disease. We know the leading cause of death in people living with chronic kidney disease remains cardiovascular disease. Save your kidneys, protect your kidneys, save your heart is very much the slogan here, isn't it? So what this NICE guideline tells us to do in people with type 2 diabetes at high risk of cardiovascular disease, so a 10-year cardiovascular risk score of greater or equal to 10%, we should offer metformin, and then as soon as metformin is tolerated, we should initiate an SGLT2 inhibitor. So early combination therapy, again, with both metformin and an SGLT2 inhibitor for those at highest risk of cardiovascular disease. So a clear theme, isn't there now, Patrick, for us working in primary and secondary care in 2022 for our high-risk patients, early combination therapy. But as you said, of course, Patrick, we mustn't forget about the other cardiovascular risk factors, blood pressure, lipids, and of course, lifestyle interventions such as smoking cessation and weight reduction, because KDIGO do specifically mention weight as well, don't they?
Absolutely. That's the other thing which is new in this, the 2022 update from, remember there was an update in 2020, but yeah, weight reduction and pointed us to be using GLP-1 receptor agonists actually as the next glucose lowering therapy. So although our NICE guidance didn't quite go that far, but it's I would certainly encourage anybody to look at the KDIGO 2022 update. Definitely.
Great. Thanks very much, Patrick. And thanks everyone for listening. I hope you found that helpful to try and clear up some of the confusion about SGLT2 inhibitors versus metformin as an initial treatment for diabetes and CKD patients. So please follow us on Twitter at GoggleDocs for more hot topics and discussion about all things CVRM. Thanks for listening, everybody.